Hello and welcome to HealthWatch. I'm Dr. Vince Yelmy. On behalf of the physicians and staff at Ephrata Community Hospital, I'd like to welcome you to this segment. Today we're going to be talking about weight loss and bariatric surgery, and we'll be right back after this message. And welcome back to HealthWatch. Today we're going to be talking about weight loss and bariatric surgery, and as our guest we have Dr. Matthew Davison, who is a bariatric surgeon working at Ephrata Community Hospital, and a patient of the bariatric program, Nick Saraguso. Welcome to the show.
Thanks.
Thank you. Nick, looking at you, I wouldn't think you'd be somebody concerned about weight loss, but part of our show here today is to give your story as to what you went through and looking at you now, kind of the transition and what you experienced. And so we'll be talking about that. But I thought really just, again, for people who need to know about bariatric surgery, and Matt, you've been doing this surgery for some time and have quite a experience with it, you know, explaining what is the bariatric surgery. We're kind of updating everyone, if you've not known about it before, what is the surgery. For those of you that know the surgery, kind of what are the new things on the horizon and kind of what the statistics are looking at. So just give a quick outline then of what the surgery is.
Sure. Well, bariatric surgery or bariatric medicine is basically the study of weight loss. And so it's more than, you know, most centers do more than just surgery. So we like to refer to it as bariatric medicine. Right now, approaching 60% of the population in the United States is overweight, so it's a very serious problem starting from adolescence on up through. So currently there are three main surgeries. We can talk about those later on if we get time. The lap band, the gastric sleeve, as well as the gastric bypass surgery. Nick, who we have here with us today, obviously very successful, had the gastric bypass surgery, and so we can talk about those maybe individually later on.
Yeah, and again, I think the emphasis is as we talk about the weight loss program, like you described, it's a bariatric program rather than bariatric surgery, because it really we're encouraging weight loss, but other methodologies. But this is you know, the bariatric surgery is a part of that whole process. Correct. If necessary.
Correct.
How do you you know, just give us some of the parameters that you look for in a patient that in fact you might consider for surgery. I mean, I know we've had shows where we presented the wellness program, and we're going to talk about what that was in the past. But you know, you finally get to a point where you're saying, geez, I think you would really benefit from surgery. So give me a profile of a patient you might look at.
Sure. And if anyone out there is interested, their physician can help them. But in general, we look at something called the body mass index, which is a relation of the patient's height to their weight. And in general, if that number is over 40, they're a patient who would actually qualify for the surgery. If their number is 35 or higher and they have medical problems related to their obesity, such as diabetes, sleep apnea, hypertension, etc., then they may also qualify at a slightly lower body mass index. Of course, we discuss with patients usually several months before they would actually undergo a procedure to make sure that socially, mentally, medically, you know, everything's in line so that they would have a successful outcome. Everyone who's may qualify medically with a body mass index may not be a great candidate for the surgery. So that kind of is a patient-by-patient basis.
Right. Do they still require you to undergo some program prior to the surgery? I mean, I know that was a requirement we had before. Are you still seeing that? Because you have various success with weight loss programs, I think you can speak to that. But the recidivism rate, the gaining back of the weight it's quite discouraging, even for people that have been very aggressive with it. Speak to that a little bit.
Yeah. Basically, right now in our practice, speaking of the weight regain, we have about an 11% weight regain rate. So it is behavioral dependent. 100% success with losing the weight immediately after the surgery, and again, 10-11% of the patients over several years will regain that weight. So that's something that we try to obviously counsel them on long before they even undergo the procedure. And so I think over time are getting better and better at choosing candidates and people who we think might not be ready to undergo the procedure. And we try to weed them out, if you will, in advance. And insurance companies help with that. They are loosening the parameters a little bit because they're seeing the dramatic medical improvement in patients. So it used to be very long diets. It's very dependent on the insurance. Some of them still require you know, psychiatric evaluations beforehand, and 6-month diet, 9-month diet, 3-month diet. It is variable. I will say in general, the insurance community as a whole are lightening some of those. There will always be some, but they are seeing such dramatic medical benefits, they are lightening some of those. It's a case-by-case basis as well.
Well, yeah, and I think you talked about before the show is that the typical person that loses weight, dramatic weight loss, their ability to keep that off is not very good as compared to the surgery.
Yeah, like I said, I guess if you look at 11% weight regain rate, you could say it's an 89% success rate. There was a huge study out of California with over 1,000 patients where they had to lose 50 pounds on their own and maintain that for 5 years or more, and 0.7% succeeded, 99.3% failed. So most people out there can lose weight if they want to and they're motivated. The problem is keeping it off for 20, 25, 30 years, and I think that's where bariatric surgery has its advantage.
Yeah, that's the long-term benefit that we're really looking for. We got to really turn to Nick. I think that I'm just fascinated by anybody that can do what you've done, but I think particularly I think as an encouragement to people, it would be worthwhile hearing your story a little bit. You're
46 now.
46-year-old. Have you always had a weight problem, Nick? Was that always a problem?
Yes. Yeah. About 10 years ago, I had started to lose weight, started going to the gym 7 days a week, 2 hours a day, lost about 170 pounds in about a year, and kept it off for a year or two, and then little by little was putting it back on. And what had happened to me was I got up to the weight I was at, and last year I was turning 45, and I had seen an ad in the paper for the weight loss center that they had a free seminar, and went to find out about the surgery. My insurance had changed their views on it, that they would approve the surgery. And after going to the seminar and finding out about the support group, I started the process.
Yeah. What was the maximum weight that you were, if I may ask?
Probably about 365.
Yeah, I can't even imagine that looking at you now, but then we have some pictures I think that we're going to show of your before and after. You gave us permission to do that,
right.
So I appreciate being able to do that. Again, our point here today is more of a motivational issue, I think, for others who may be considering that, and certainly people who have weight problems. But so you know, it's fascinating to me that you would have lost all that weight and then going back and gaining it back again. I mean, it seems like once you've been there, boy, I'm never going to go back. But yet it happens over and over again. I mean,
things in life, you go through divorce and issues that come up, and
well, it does speak to the psychological aspect of eating.
Yeah,
it tends to be a release
if I could add one small thing
Sure.
here, I think when people are motivated to lose weight, there's only one true way to lose weight, and that's to eat less calories than you spend. And there's no way around it. When you do that, your body's signal to that is hunger. You're going to feel hungry, and people will quell that for a certain period of time, but it's very hard to maintain that feeling over the course of your lifetime where you're constantly fighting hunger. These procedures aren't magical. People still have to diet, still have to exercise. It's not easy, but it helps that hunger part of the problem, and that's where the surgeries come in. To maintain it long term and to fight that feeling of hunger is very difficult for anyone to do.
Yeah, speaking of that, and it's an offshoot of this, but I know that the medical community is desperately looking at the magic pill that, in fact, that suppressant to that issue that's going to obviate the need for surgery, because nobody wants to have surgery, but yet that's not happened.
It's not really happened, and again, most of those medications have side effects, and they have to be maintained forever. They can be expensive. You have to take them faithfully. Over time, the effect tends to wear off. So they're, obviously, if they could find the magic pill, if you will, that of course would be better than surgery. I think anyone would agree, because it's non-invasive. The problem is we really don't have that. We really don't have that yet.
Yeah. Okay, but some of the other issues that we've talked about on this show before was the complications that occur with obesity. I mean, we've talked about just the fact of high blood pressure, sleep apnea, diabetes. Those statistics have still maintained themselves. I think, Matt. I mean, the curative rate of this surgery is quite dramatic as it relates to some of these things, and we'll talk to Nick about his particular issue. But just generally, what are you hearing?
It is the big ones are sleep apnea. It's about a 95% 25% cure rate of sleep apnea. It's about an 85% cure rate for diabetes, which is the big one affecting people in America. It's the only known actual cure of diabetes in the world, really. And about 85% of people will be off of all their diabetic medications. Hypertension, between 60 and 70% cure rate, et cetera. And those have been years and years of data, so those have upheld over the years, and that looks like that's going to be good statistics.
Yeah, as an ex-pulmonologist and growing up with the whole idea of sleep apnea, I was very attuned to those type of things in my practice, but realizing, and you emphasize the diabetic part of it, but the incidence of stroke and cardiovascular disease in undiagnosed sleep apnea patients before we were aware of it even, and then before we were about the weight loss issues, is dramatic. I mean, it's a significant problem. So it is a dual benefit. All right, we're going to take a break and come back, and I want to hear more then of your story, Nick, what your experience was with the surgery. And we'll be right back after this message. And welcome back to HealthWatch. We've been talking about bariatric surgery and weight loss, and Nick, getting back to your particular story, I'm anxious. You, as you said, you were 40-some-year-old, 350 pounds, have been through several weight loss programs, I'm assured, and now you've entered into this program. You were relating to me, you actually did lose a fair amount of weight before even having had the surgery. Tell me a little bit about that. I mean, we encourage that, I know, at the Wellness Center to try and get people into programs of weight loss. It's sort of a mental thing more than anything. What did you do and why did you do it?
Well, in order to have the surgery, there were certain criteria that I had to meet for my insurance company. 6 months of nutrition visits, psychiatric, and I had to attend support group. And I had said to myself, if I'm going to do this surgery, which is, listen, it's the last step, I'm going to make a concerted effort to do the best, that I can before the surgery. And I started seeing a nutritionist. I started changing my eating habits on my own. In going to support group, I had heard how people were eating 5 times a day, smaller meals, and I started altering what I was doing. And I also took a look at where I was at in my life, where my marriage was, where my job was, and I had gone for some extra psychiatric visits, just to make sure that, my head was in check. And started seeing the nutritionist every month, and just had steady weight loss. Couldn't believe that I would have lost 102 pounds before the surgery.
Wow. Yeah.
Would have been happy with 30 or 40, but I just kept doing what I was doing, and I was committed to doing it.
Yeah, I mean, it's just talk about the psychological issues. I mean, we're not saying anybody's crazy in this thing, but it does speak to the psychological profile of patients presenting themselves for this type of surgery. What were the thought processes that you had to go through? I mean, like I say, you talked about some lifestyle issues and all those things. Was that a change in habits that you had to develop?
I had to take a look at where I was at as a person, wanted to make sure I was in a good place. Took a look at my marriage, make sure I was in a good place there, because I knew with this change that I was going to have to devote a lot to just, the process of the surgery and the recovery. And I changed some of the things I did in my life.
Right.
I had certain issues in my life I tried to let go, and really tried to make my marriage better, tried to make myself better as a person. And, I can say that I've made a lot of changes in the last year. I think I'm a better person than I was a year ago. I'm still not perfect, but, definitely I feel that I'm in a better place now than if I never started the whole process for surgery.
Yeah, that's a good motivational issue. But well, talk to me about even the physical problems you had. At 350 pounds, I mean, what were you able to do? I mean, it seemed to me you would certainly be limited in lifestyle issues.
Well, you'd run across things where if you go into a restaurant, you can't sit in a booth. I did ATV ride at 350 pounds. I was healthy, wasn't on medications for anything, but having diabetes in my family, it was a concern.
Sure.
And when you turn 45, you just kind of take a look at where you're at in your life and what you want to see between 45 and 50. And I honestly felt to myself, if I didn't make some changes, that diabetes would be knocking at my door.
Yeah.
And
Well, the statistics, Matt, I think still, if I look at that, I can remember obese. If you're an obese person at age 45, the chance of you living past 65 statistically were significantly decreased. I mean, it is a life-shortening issue. I mean, so I think you're right. At 45, am I going to be alive at 60 or 65? And statistically, you have a pretty good chance you wouldn't be. So I think that's
Right.
if anything else motivational, it would be something like that. So you're into the program now, and now it's time for the surgery. How did you describe what you had to do? I assume you met Dr. Davidson at that point in time
Right.
and start discussing the surgery and your options.
Well, I started with the nutritionist appointments. We went for the psychiatric evaluation. Then there was some testing I had to go for in the beginning, and kept seeing the nutritionist, kept going to the support group, and then there was some testing at the end. But with the support group, going every month and the friends that I made in the support group, I knew everything that was going on before it happened, and there was not one surprise. Everything was exactly the way it was supposed to be. The nurses after the surgery were calling me every day and did not have one bad thing I could say about the whole surgery process. But the thing I'd like to say is I think I was in the right frame of mind for it. And that is a big part of it.
Yeah, I'm getting that impression. Talk to me about the support group. Are these people who have had the surgery, or are nursing personnel? Who are these people?
Well, I had gotten into this when Ephrata was originally starting the program, so a lot of the people that were in the program were beginners like me.
Okay.
Certain people went before me, and one of the nice things was seeing people after surgery a month, 2 months out, and how they've changed. And I still go every month, and it's just amazing that we have people that have lost 100 pounds, 140 pounds. And, a lot of friendships have developed, and we can talk pretty freely about the life changes that have happened from the surgery, because it definitely changes the way you look at life and the way you look at friendships, relationships, and these people can understand what I'm going through.
Right. You talked about the decision, again, there's various options we can have now. We talk about banding, and we talk about the bypass surgery itself. Your decision to have the bypass surgery, you talked to Dr. Davidson. Why did you choose that particular procedure?
Well, at the time when I had met Dr. Davidson, he said that the gastric bypass was the way to go. And, I just felt very comfortable with Dr. Davidson. I felt very comfortable with the nurses at the Weight Loss Center, and that was what I decided to go with. And through my process, I guess about 4 or 5 months in, I had lost about 70 pounds. I had gone to Dr. Davidson and says, well, maybe we should think about doing the banding. It's not as invasive. And Dr. Davidson said, stay the course. This is what I recommend. And that was what I did, and I can tell you right now, I'm really glad that I took his advice and I stayed the course, because I have no regrets.
Okay, we got to take a break, and I want to come back and describe your surgical experience. What was that like? And we'll be right back after this message. And welcome back to HealthWatch. Nick, when we left you, we kind of talked about your prep for this, but I really wanted to make sure that people understand the surgery itself. You go in Ephrata Hospital, and you had prep for this. Again, anxieties that everybody has about surgery. I'm sure I would have the same feelings, but was a decent experience for you.
Yes. I had a good support system in place through the people from the support group and through my wife, and I was set up that, I was going to be out of work for about a 2-week period, and went in for the surgery on a Wednesday. And I knew everything that was going to happen in the hospital beforehand, because the people at the support group had told me. I had a great experience at Ephrata Hospital. The nurses were fantastic. Got out of the hospital on a Friday. And
So just in there for 2 days.
that was all.
Right.
And then recovered at home over about a 2-week period. And then, I was up and I was driving probably about 60-70%. And then it probably took about another 4 to 6 weeks to get to where I was about 90%.
Talk to me about the immediate thing. What everybody would think about is, we're creating a smaller pouch for you to eat. What was that like what were the dietary restrictions you had, and how'd you work your way through that?
Well, for the first week, was more or less like clear broths and so forth, and then the next week it got in a little bit more into some things like puddings and so forth. First week was probably easier than the second week, but they gave me a book. They told me what to do. I talked to the nurse every day, and got through it fine.
Really, and as you progressed in your eating, how kind of where are you now with that? I mean, how far out are you? I hesitate to ask.
I am about 10 months out.
10 months out.
Right.
And how much weight have you lost in that period of time?
Since the surgery, I lost another 77 pounds.
77 pounds.
Right.
So,
total loss was 179 pounds, which was half my body weight.
right. Yeah, you're about 180 now from what you told me.
Right. Mm-hmm.
Yeah. So that's just fascinating to see. And Matt, that's not unheard of. That's about what you would have predicted.
Yeah, that's not unheard of. And Nick, we were speaking earlier about what a great patient he is. You notice the focus on when he's speaking. The focus isn't on the surgery. It's on the lifestyle change. The surgeries are really a small part of that, and the person has to be committed. He showed his commitment by losing weight before the surgery,
Yeah.
and so obviously he's someone that has been very successful, and that's what it takes. The mindset of the surgery is not the crutch, but rather just a tool to help him get where he wants to be, and those are by far the most successful patients.
Yeah. Nick, it's getting back to now your diet now. Tell me about a typical day in Nick Saragutz's.
I get up 6 o'clock in the morning. I eat breakfast. Then I have a snack at
Now,
10
are there portions? I mean, I keep thinking of the pouch and the restrictions on what Dr. Davidson has to do to your stomach to actually make this work. So it has less capacity. So how do you regulate your portions? Do you kind of know what you can eat?
Yes, I do, and I really kind of keep to eating the same type of foods. If I don't sway, it works for me. Like for breakfast, I would have like a bagel thin. That would be my style of breakfast. I could not eat 2 eggs, home fries, and toast. I just would not be able to eat it. It would be too much. And then I have a snack at 10 o'clock in the morning, usually like a protein bar. And then I have lunch at 12. 3 o'clock, I have trail mix. I have my dinner at 6 o'clock. 7:30, I do a sugar-free popsicle. And 10 o'clock at night, I do some ham and cheese rolled up with mustard.
Yeah.
And I do it every day, and I'm committed to it. When I travel, I bring everything with me to the hotel, and it's a committed life change.
Yeah, it's unfortunate our society wouldn't be conducive to that type of a dietary thing, because just portions, we talked about that before. But it's an interesting thing. You kind of bring out something I've always believed in. It small portions more frequently in our diet. That's not the way we eat, and yet that appeals to me. I find myself at 10 o'clock. Gee, I need to get something, and I'll grab a whatever protein bar or something, and small lunch. It just fits. That's the lifestyle. And here you are having a surgery to get to an eating habit that all of us should really emulate without the surgery, quite frankly.
One of the things that I had noticed was normally I would eat at 6 o'clock at night, and I would have this subconscious fear in my mind that I'm not going to eat until 6 o'clock in the morning. So I would have 2 full portions. And when I started going to the eating 5 meals a day, I don't have that fear anymore, because I know that in 3 hours I'm going to eat again. And it's also changed my metabolism, big time. And I like what I'm doing. I'm committed to what I'm doing, and I wouldn't change a thing.
Just going to ask one question. We only have a little bit of time yet, but as far when you lose this much weight, obviously, looking at you, and we've had these before and after pictures. The obvious question is what happens to all that skin folds, etc. Have you considered, or are you considering having any other surgeries done for that, or is it even a problem? I look at you now, and I wouldn't think it would be, but I know some people actually have that as a follow-up because, in fact, it's a whole masses issue.
Well, I'm grateful that I have a support group to go to, because there are several of us now that are talking about it. Nobody has taken that leap yet, but there's a couple of people that are looking at it, and there's some people that are a couple of months further ahead than I am, and I really would like to see how they do
Sure.
to see if it's something that I would be interested in doing. But I'm definitely considering it.
Yeah, I mean, it's something that is part of the process. I know. I don't know how often you see that, Matt. Or
Yeah,
whether
about
you-
25% of our patients will undergo it, and some of them it's medically necessary, others it's more cosmetic. So it's, again, an individual basis. About 1 out of 4 will go on to have the, the skin removal surgery.
Yeah,
So
kind of a body sculpture thing. I know we can do that at Ephrata as well as part of the program, but which is kind of interesting. So it's only 25%. I would have thought it
about
more.
25%. Some of that is just cost and insurance coverage and so forth. So it just is variable.
Yeah. Well, I just really appreciate you being here today, Nick. It was great hearing your story, and Matt always is updates and what the surgical procedure is. And good luck to you in the future.
Thank you.
We'll look for great things for you. Thank you for coming, and thank you for watching HealthWatch.